already checked the physician's order. I also checked the Times care plan. I obtained the placement check, and I also got the length of tube extending from the nurse. I'm gonna go ahead and perform hand hygiene and then gather all my necessary equipment that I need. I'm gonna go ahead and jump in.
So I'm gonna listen to your chest first, okay?
Can I come in? Good afternoon. I'm student nurse I'll be your nurse for today. Can I check your ID band? Can you tell me your name and date of birth? Okay, Mrs. Jones. So the plan for today is I'll be checking the placement of your NG tube and also do a tube flush. Do you have any questions before we start? No? Okay. I'm gonna go ahead and close the curtain for privacy. I'm gonna go ahead and lift up the bed, the height of the bed and the head of the bed to a follow position.
Everything sounds clear and normal. When was your last bowel movement? Do you know? It was this morning? Okay.
Put my
So
gloves
patient's
on.
last bowel movement was this morning. So,
Anywhere between 30 to 50
we're gonna get started, okay?
Lock the bed.
I then hold the syringe about
I'm gonna go ahead and clean my stethoscope.
Okay, so just wanted to make sure before we get started that within the last hour you haven't had any medicine or feeding. No, you haven't? Okay, thank you.
Go ahead and clean my stethoscope and then listen to the lungs and the bowel sound.
Feeding repeats. Now I'm gonna measure it.
Inhale, exhale. Again.
Okay, so I'm getting 29,
Again.
which is the same as what was on the
Again.
patient's report as the last
Go ahead and
one.
listen to the side.
Now I'm gonna check the placement in the back of the throat, make sure that I see the tube.
So the lungs are clean, clear and even. We'll go ahead and listen to the abdominal.
Okay, so I do see the tube in the back of the throat. Your mucous membranes appear moist and pink, so everything looks normal in there.
Okay, bowel, active sound, so that's good. When was the last time you had a bowel movement? Yesterday? Can you tell me the size, medium, small, small? How about the texture? Was it soft to pass, hard?
Make sure that it's soft.
Soft to pass, and how,
You're gonna
what color
open
was
the
it?
clamp.
It was brown?
You're gonna pull
Okay.
about 5 to 10 ml.
Go ahead and put a pad over your chest. Keep your gown clean. I'm gonna go ahead and unclip this from your
Make sure that you
gown.
close the clamp before you remove the syringe. Now I'm gonna get the pH.
And go ahead and measure the length of the tube.
So the pH of the stomach contents is 4. You want it to be 0 to 4 to make sure that it's normal. If you're not able to aspirate anything from the stomach, then
So I got 35 inches, which is the length that was noted in the chart.
the placement is incorrect.
And go ahead and check the placement of your
Now you're gonna put the
tube. So
contents back
I'm
into
gonna have you open. I'm gonna check. You can see the tube behind the throat, so that's good. At this point, I'm gonna ask, or I'm gonna ensure that it's been more than an hour since the patient had any medication or any feeding. I'm gonna go ahead and ask for some gastric fluid.
Before you flush it. Warm tap water is optimal to not irritate the stomach or cause cramping. You're gonna hold the
Now I'm gonna go ahead and check the pH level.
To let gravity have the water flow down nicely. And you're gonna put about 30 to 50 in
It's at a 4. It's a normal. Normal is between 0 to 4. I'm gonna go ahead and also check the residual, which is at
And then I'm gonna open the clamp.
20 ml. I'm gonna go ahead and return this back into the tube.
Okay. Okay, Mr.
Close it.
Smith, would you like oral hygiene gloves?
And then at this time, if if I'm unable to aspirate the gastric fluid back into the tube, I'm gonna go ahead and check the placement of the tube. Also check if the length of the tube has changed. I'm also gonna not order but do X-ray per physician's order. But this she's fine, so we're good at that. I'm gonna go ahead and
Replace the
remove this.
And I'm gonna lower the
Go ahead ahead and flush her tube down.
Okay, so, are you comfortable at this elevated position? You are? Okay.
I'm gonna do 30 ml. You can do anywhere between 30 to 50 ml. Go ahead and unclamp this.
Checking you, but if you need to push the light, I will be coming back to assist you. I'll look into the findings, and make sure that you're,
Go ahead and clamp this.
aware of what happened. So I'm gonna jet out. I'm gonna,
And at this point, I'm gonna ask if the patient needs any oral hygiene. If not, then I'm gonna go ahead and clean up my area. So I'm gonna
and the iron. Thank you.
put this back onto the gown. Go ahead and lower the bed. Make sure the patient is in a comfortable position.
Yeah, I'll take it. I didn't like hesitate or nothing. No.
Okay, Ms. Jones, I'll come back and check in on you in a few hours. I'm gonna go ahead and forehand hygiene. And then document the placement check, the physical assessment, the client's position, also the client's tolerance and the amount of intake and outtake.